So I think, one of the things that's important in the development of digital health is that people haven't really focused on, because they've been really enamored by the technology, is the usefulness. And in medicine, even more so, usefulness and clinical and economic value are much more important because of the effects of what they show in terms of data that has both positive and potentially negative consequences, as well as the cost. Because unlike, you just feel like you want the latest iPhone, you can just go buy it. If you have a medical condition and someone prescribes something, or you want to use something to gather some data, are you the right target population for that product? Is the data going to be meaningful? Has it been proven to lead to a change in how your doctor or your healthcare provider would manage you? So I think we're coming to a fore now after the last 5 or 10 years in which wearables and smartphone-enabled devices and applications have made a huge impact in the consumer world, but people have also tried to start applying it to the medical world, and I think now are realizing that healthcare represents a different type of environment in which the clinical context is actually really, really important, and the patient situation and what is needed for them is actually perhaps even more important from a clinical need standpoint than just the gadget. I think the gadgets are important in providing tools that basically we can look to as parts of many tools we've always used, from the things we've used to develop catheters in medical devices or pharmaceuticals for other disease states. Data and smartphones are just another technology. I think the real important piece is let's focus on the unmet clinical need. In my role at Stanford, we're in a program which we focus on really identifying unmet clinical needs and then figuring out the best way to solve them. So unlike the hammer and everything looks like a nail, meaning smartphones, everything looks like a problem that can be solved with a smartphone, let's actually focus on the problem and see if the smartphone for a given problem is the right solution, or maybe not. Going forward, I think we go back to applying good core fundamental principles of the development of any technology or any intervention or diagnostic for a patient. What's the problem? What's the solution? What's its cost? And more importantly, what are the clinical outcomes that are derived from using this tool or technology, and is that cost effective in a given population? Good old statistics and good old trial design, but I think the trend towards consumerization might work in certain cases, but at least from what we've seen in the Fitbits and the wearables of the world, those might be good to motivate some, but it ends up seeming to me that they end up making the fit fitter, and the unwell fit for a little bit and then perhaps fall off the wagon because behavior change is hard. So that being the case, the technologies are really good, but let's figure out what's the right patient population for whom the data is actionable and for whom the patient population will actually comply to get meaningful data. There's no need that needs to be addressed by a particular technology. That technology, like everything before it and everything after it, are just other ways of solving problems. So I think the key is we should look at the things which are challenging the US healthcare system today are an increasingly longer lived population, living with many more comorbidities, meaning that more cost. So I think from a healthcare standpoint, the thing that's drove the ACA and other things is value. So mobile technologies should be used in ways of providing solutions that, because of the ubiquity of smartphones or other types of devices, allow for cost-effective solutions, but again, they have to be solutions for problems that are actually relevant for patients. And that might not mean everybody, it might mean smaller segmented groups who might be highly motivated to do something, and that's okay. I think the challenge has been, if you look at the tech world and the proliferation of all these devices in healthcare, it's not the same. A disease state in one patient may not be the exact same disease state in another in terms of how they're presenting, how they're managed, what their outcomes are, what stage of disease, and so the tools you use may not be the same. Well, I think that's an important point about the idea that technologies develop in the consumer world. In that situation, the people developing those technologies are also the users. In healthcare, the people developing the technologies, by and large, are not the users. And so, in terms of understanding users, of which you mentioned the elderly or the aged, I think it's really trying to do what we do also at Stanford, spending a lot of time observing and diving deep to understand what patients' lives are like. So for instance, if I was just having a conversation with a person who focuses on geriatric cardiology, so a lot of elderly patients may be unsafe at home, but they want to live at home and be independent. But they can't see the icons on a smartphone. It's just too small, or they have arthritis and can't type. That doesn't mean there isn't a role. So there might be a role for a caregiver to, maybe you can install, I mean, again, not trying to get the solutions, but is there a way to seamlessly integrate into the lives they have at home? What do you care about? Are they moving around? Are they getting up and go to the bathroom? Things like that. That may have actually nothing to do with them. It could be part of your house, the Internet of Things. So I think it's really more focusing on what's really important for the patient, and particularly for elderly, it's independence, it's quality of life, it's longevity too, but not at the price of feeling bad necessarily. So when you take those into context, the solutions, they may still be digital health, but they may actually have a very different flavor than if you came at it with what can I do with a smartphone for an elderly person.